Hi, I'm Thiago Morelli, a periodontist here in North Carolina, Implant and Periodontics, and I'm here today to talk about a brand new service that you're offering here in the office, which is the use of a microscope to do periodontal surgery. So this, I can tell, it's a subspecialty of the periodontic specialties, which is when we train to use a microscope to perform the procedures that you usually do with like a normal loop or sometimes without any magnification. But the advantage of using a microscope to perform periodontal surgeries is because by the aid of this instrument, I can perform like a very predictable procedure with the minimal amount of trauma to the patients. And if you wonder what type of periodontal surgeries you can do with this machine, is basically almost any type of periodontal or implant surgery. Of course, there are certain type of procedures that have a much better benefit when you use this, such as gum graftings, for example, or periodontal regenerative procedures, when you try to grow back the bone or the gum tissue that was lost because of gum disease, for example. The use of this machine, along with my skills, with my surgical skills, allow me to do procedures that will cause a lot less trauma to the patient, having a lot less pain, a lot less chance of having bleeding, and a much more predictable outcome. So the three main advantages of using a microscope to perform periodontal procedures is: one, it's a much less invasive procedure. Second, it gives the patient a much better outcome with less pain and discomfort after the procedure. And the third advantage is a much rapid recovery for the patient. Hopefully less time out of their job or getting back to the normal routine in a much faster way. So to perform periodontal microsurgery, it's not just required my skills and the microscope. We also need to have a special set of instruments that will allow me to use the microscope and the magnification that can be up to 20 times bigger than what my eyes can see. And that includes different forceps, different blades, and also the suture material. Like if you see the difference between the suture that I usually use in a normal procedure comparing to the one that I use with the microscope, you can easily understand why the patient has a lot less pain and discomfort afterwards. It's a much more delicate procedure that will allow the patient to have a much faster recovery, and for me as a periodontist, a much more predictable outcome of success. Another procedure that the use of the microscope can add and help me a lot on getting good results is when patients, they have infection around dental implants, which is very difficult to achieve a good cleaning on the implant, on the metal. But by using the microscope, it allows me to see like 8-10 times bigger than the natural view. And that allows me to clean the implant a lot better, which increases the chance to stop the infection and then have a much better result on cases when patients are having bone loss around the implants. This is the Zeiss Extaro 300. It's an exceptional microscope that allows me to have like up to 20 times magnification of the field. It also allows me to have a very good way to document the cases and then exchange with patients what I'm seeing on the higher magnification view for them to understand what I am seeing and what I have to treat. Another good advantage of using a microscope like this is that the lighting on the field I cannot replicate with anything else. It has a very good way, and that allows me to see the procedure in the best way as possible. And of course, the way that I can move these around during the surgical procedures it makes it very easy for the surgeon that are seeing something of really high magnification to have a very delicate movement that doesn't, in the end, make it harder for me to perform the procedure. So I'm happy to be the first periodontist to bring the use of microscope to the Carolinas. And if you are interested to know if this can help you, please come visit us.